And that relative value unit, does that relate to income?
It does. So, and what I'm going to do, Parker, just to make things a little clearer, I'm going to pull up some 2023 numbers, and this is for Alameda County, California, in the Bay Area. And let's talk about the code 90834, which I mentioned a little bit earlier. So for the code 90834, the total RVU, so that's taking the different components that I mentioned and adding them together for Alameda County, California, you come up with this RVU value of 3.34 RVUs. So if you do a 45-minute therapy session with a patient in Alameda County, California, the federal government would say, hey, that's worth 3.34 RVUs. Okay, well, then we've got to convert the RVUs into dollars. So if you were billing Medicare, so if you were seeing someone who was 70 years old and they were using Medicare, you would be reimbursed $33.89 per RVU. So that $33.89 times 3.34 RVUs is $113.32, which, Medicare in general pays reasonably, right? There's Medicare, which is the health insurance for everyone over 65, and then there's Medicaid, which has different names in each state. Medicaid tends to reimburse much less than Medicare. But the reason I recommend using the Medicare established RVUs is this brings logic to how you set your charge master. And in general, all commercial insurance companies look to what Medicare does with its RVUs and reimbursement policy, and then they tend to follow suit. So, for example, if Medicare decides to start covering a new procedure or there's a new CPT code, usually the commercial insurance companies will follow suit after this. There is logic to how Medicare set, it's still subjective on some level, like how do you decide the work of a therapy session versus knee surgery, but we won't get into intricacies there. But for the 45-minute session, which is 3.34 RVUs, then if you jump to the 53 plus therapy session, it jumps to 4.92 RVUs. So this is why, there is sort of a logical, okay, you're doing a longer session, you're getting 1.5 approximately extra RVUs. It makes sense. And so we want to, whether or not everything else in the healthcare industry makes sense, and certainly insurance companies and most practitioners don't set their charge master based on RVUs. But I think it gives you a leg up in explaining your charges, both to your patients and if you're going to be brave and try to negotiate with insurance companies.